What's up, everybody? How are we doing? It is time for the two craziest people at the meeting. I think that's official. Chris Feldman, Jeff Kozlowski, and it's time for some Eff Bombs. Can we do that? No? Okay. Efficiency bombs, all right? I've been looking forward to this all weekend. So why did we put you two together? I have no clue. Also, Chris, I got this for you. It's a bruh button. I got the bleep for it. So if you start going too long,
bro.
I'm saying bro.
Can we get a bro button or bruh?
You say bruh, don't you?
Bruh, bro. Try to mix it up.
Well, all right. He doesn't like it.
It's all right, bro.
And we got to say, I forgot. Last night we were just joking.
That was a joke.
That was wrestling. Did you realize there was a chair that came out of nowhere?
There was a chair.
I broke 2 bottles on Chris's head. My mom texted me. She was like, "Are you okay?" Double question marks. I was like, "Mom, if Mom's watching, Mary Jane, I'm great. No scars." I did get into an ambulance, and then they actually also lifted me down out of the ambulance. It was great. So how are you feeling?
This was the bed elevated before they took you out, right?
It was really great.
Honestly, I enjoyed Stone Cold stunning you.
Yeah, you did.
I want to do that to some more of my colleagues,
okay.
But I love you, man. And yeah,
for sure. We are good. Don't worry
if we weren't tied up to these mics, we'd be hugging right now.
Yeah, but we acted so well that some people thought it was real. It was not real.
Nice.
All right, so Jeff, you're the efficiency guru, bruh. What is it, and why is efficiency important?
I think really it comes down to 2 things for me, administrative and clinical efficiency. And people are going, administrative? I thought this is all clinical that you focus on. But so from the clinical perspective, efficiency is really about the number of visits it takes to finish treatment.
Okay.
So if you have a practice that does, pick a number, 500 starts, and they have 10 visits to finish treatment, and another one at 500 starts has 20 visits, they clearly have double the amount of work to do for the same production, same number of starts. Administrative efficiency comes in on treatment time, and we're not going to spend a lot of time on that today, but it's another topic. So a practice that averages, say, 18 months of treatment will have half of the active patients of the same size practice that takes 36 months in treatment. So the longer your treatment time, the more patients that are actively in treatment, and Chris and I will get into a little bit of this today. Cool.
So Chris, you told me that you went to a course at Koz's office and, quote, you became obsessed with efficiency. I'm a little worried about you.
Don't worry about me, bro.
But first, tell me about that obsession with efficiency.
Well, so it started, we try to go on a team trip, team conference every year.
Yeah.
And Jeff and Jamie Reynolds were having a little mini conference in Chicago back in 2017. And I thought that would be a nice, I love Chicago. That'd be a nice opportunity to go get some learning done and have some fun, good team meeting. So we went, the whole team and I went to Chicago. And from the start of their conference to the end, my mind was blown. Yeah. I was in the front row taking notes. And, Jeff kind of opened the door to me, opened my eyes of what clinical efficiency is and why it's so important. And from then on, I went home the next week. I told Jeff, I was like, I need some changes. I went home the next week. First thing is I figured out that I was having way more appointments than I thought I was having to finish a case. I was right around the 20 to 21 appointment per full braces case. And so I made it a goal to minimize that. I also instantly took at least 30 planned clinical days off of my schedule. I was working 4 days a week. Why? Because orthodontists work 4 days a week. And while I think we're blessed to not have to work 5 days a week, I realized I don't have enough patients to justify me working 4 days a week every week. So, that kind of opened up some doors for me to have more time with my family and for our team to have more administrative days, which can be very productive.
Well,
as we can talk about.
And getting into it, what's really interesting, and this is for you, my lovely wife, when we're in New Hampshire and I get a call and you're like, who are you talking to now? I'm like, Feldman. He was the best student we've ever had in terms of loving the appreciation of what we're doing. So, and she's like, oh, that's awesome. And, Chris called and he'd say, I'm at I thought I was doing really well, but I'm at 19 visits to finish treatment. And I said, listen, world class is probably in the 13 visit range, but think about it, from 19 to 13 visits to finish treatment is
It's a big jump.
It's like you're dropping your number of visits pretty significantly.
Yeah.
And so what that translates into, which as an older guy I was saying, is quality of life, maybe hiring less team as you grow, maybe working fewer days. Now, by the way, I just want to say this. Working fewer days means seeing patients in the clinic fewer days. So for the business owners, we know that means you divert that time to doing other stuff to make systems run. And that's really what efficiency is. When you're in the clinic seeing patients, just don't be doing wasted things. So like I have to say, Chris thinks there's like this, mentor-student relationship, but the best student that's ever been, and now producing numbers that are as good as any of the best in the country. And that's how your practice has grown, and you've had a quality of life and been able to grow that mullet out while we were doing this.
Well, yeah, that mullet is important for quality of life. But,
he has a practice that's so big that he can grow a mullet, and it just gets bigger.
Well, there you go.
It's like,
don't
care.
What's your
it's funny. I compare Jeff to like Master Splinter, and I'm just trying to be Donatello.
Yep.
But yeah, so in the past, this
You
was
actually have, I just have to say, you have more of a Raphael vibe, I think.
that could be a whole nother debate, but Donatello is the best Ninja Turtle.
No,
We'll talk about that
Michelangelo
later.
is the best Ninja Turtle by
Who's the
far.
one with the bow staff?
Donatello.
Okay, Donatello, I'm with you.
So-
the fact that you had to ask that means that you stay out of all Ninja Turtles.
I'm over
related
50, so it's
conversations.
okay. I'm
But
just
go ahead.
saying.
So in 4 years I've been working diligently at improving clinical efficiency, and so a year later we're down to 17, 18, and now 4 years later, the last 50 D-bonds we've done, we're a little over 14, and that includes emergencies. So 14 visits, and look, we all have to be honest with ourselves. You can't just pop the brace off early with an unfinished case or less than your best result and think you're improving your efficiency. You still have to have quality work, and I can honestly say that I'm no Stu Frost, I'm no Jeff Koz. I'm going to try as hard as I can to get to that level, but I'm happy with the quality and with the improvements we're making.
Sure. Guys, is it time for some F-bombs?
Yeah, I think it is. But you know what? Come on.
Yeah, let's give us the cards.
You need a break. You've been working your butt off.
I don't give anyone my cards.
Do we have to do what we
Are
did
we
last
going
night?
to relive?
I'll
Yeah.
give you cards.
Come on.
Yeah. All right, fine.
It's okay.
There could be a bottle here somewhere.
So we're going. And look, what I want to say about these
We're just
is
taking the cards.
There you go.
Kyle
What I want to
gets
say
the
about
break.
these, we can
Thank
talk
you.
about efficiency till we're blue in the face, and these days we hear a lot about aligners and the digital braces, and those are cool. I don't want to knock on those. That could be a whole other debate. But what I'm talking about, I like to refer to as free efficiency. Okay? These are steps you can take to become more efficient, where you don't have to pay more in overhead. Your overhead doesn't suffer. Anybody can do it, whether you're
And you
using,
don't have to work harder to do it.
you don't have to work harder. You don't have to use a particular product or method. Anybody can do this.
Free efficiency. I like it.
Free efficiency, baby. We
All
can
right.
coin that term.
I like it.
So, all right, I'll start. We're just going to kind of go tit for tat and just talk about
I'll
things
do
we
the tat.
do.
Yeah. Yeah.
Okay.
Let's do it.
So, number one is just simple. Don't start your cases too early. Especially like those deep bites. Wait till those sevens come in so you can help to use those to level the curve of speed. Too many times we get excited about wanting to start the case and get those numbers up, but you start that case before those teeth are fully erupted, you're going to be in treatment a lot longer, and that's going to add more visits.
Yeah, and you're
Lower
gonna
your
see how we do this, which is I agree with that completely, unless the patient absolutely positively is not leaving your office without starting braces. Then you know what? Just treatment plan the right amount of time.
True.
So don't say 18 months. Tell them I know it's going to take another 6 months for these teeth to grow in. It's a 24-month treatment. So we're not losing cases because we're waiting for teeth to grow all the way in. We're just being effective with it. So on that point, number two, treatment plan the case. I see a lot of orthodontists that say, yep, you're ready for braces. They don't give a treatment time. They don't give their team kind of a list of what's going on. So for me, treatment planning, we're a little different in this. You're going to see there's some things we do efficiently that are completely different. But by treatment planning the case, it means for my team, give them what you need to put the braces on. We're doing upper and lower 7-7, low torque, upper 2-2, turbos, lower 6, shorty, class 2 elastics, and everything to get the braces started. But then kind of making notes of kind of mile markers or goalposts along the way that you've got to check in on. Like at 8 months, we're going to update the x-ray to check on a moderately impacted upper right 3. Is the space helping the tooth grow in? So treatment plan the case.
Yeah, so
you do it differently.
I do it a little differently,
Yeah.
and this is something I started during the pandemic. I made a commitment to plan out my cases, and I try to kind of visualize step by step, appointment by appointment, what's going to happen. We know we can deviate from that, but from then on, every case that's going to start, I plan out what we're gonna do every appointment. And I have templates for some of your typical cases, like your class 1 deep bite, your spacing with deep bite, your open bite. So when you have that plan, your team members know what you're gonna want to do next, and you can kind of try to stay in that goal appointment number too. And you don't always do it, but in my plans, like what I thought was a 2-year, 20-month case a few years ago, 11 or 12 appointments with some leeway. You can do it in that amount of time if things go smoothly. In that amount of appointments.
Cool.
So another thing, number 3, we talk about phase 1s. I know that when I first got out, I had little knowledge or little experience with that, and I did too many phase 1 treatments. I think phase 1 is overused by a lot of orthodontists, and every time an 8-year-old cries in your clinic, an angel loses its wings. So in the past few years, my phase 1 cases has gone down, and I'm not putting off work that needs to be done. If they have a jaw discrepancy that needs to be addressed, or if we really need some space for some teeth, then we're going for it. But extraction of upper C's and D's can do a lot. And we don't have
I disagree.
Yeah.
Well, I just no.
And I know you do it differently, and the way you do it's amazing also. But I'm happier when I'm doing less.
But see, this is the amazing thing about efficiency, right? We are 180 degrees opposed on this, but we're both efficient. So your efficiency is minimizing phase 1s, taking out C's and D's when we need to, and waiting to do an efficient, comprehensive treatment.
Right.
Mine is when there's a benefit to doing a phase 1. By the way, an angel loses their wings when kids get C's and D's out in my office. Okay, so
I'm take them out in your office?
No, we don't take them out at all if we can avoid it. The point is, with our clinical phase 1, it's bracket and wires, upper and lower 6-to-6, no expanders, nances, fill in the blank of all the other evil appliances we can use for kids. By the way, kids cry when they have expanders and reversible headgears and everything else too. And C's and D's out. But anyway, so the point is, if we're going to do a first phase of treatment, we're going to be excellent at it, and we're going to be efficient with it and efficient with our mechanics, and just eliminate like separators and bands and scanning and delivering and removing and putting this thing in and that thing in, like braces, arch development, align the teeth, finish phase 1 with a concrete endpoint, and then await a second phase so you can be effective with that. So
nice.
Can't argue with that.
No, anyway, so another note on that. So sometimes we start phase 1 cases or our full treatment cases. We have to start a little bit early, right? You got to start before the 7s are in. So what do? You're looking at a 30 to 36 month case, right, Chris? Because teeth aren't in, the E's are still there, but you got to start for some reason because deep bite, palatal impingement, whatever the case. So why not put braces on, get them to a point where they're better, and then take a braces vacation? Right, so the orthodontists were like so attached to having the braces on the teeth. It's like that you can't modify from that. So, but now you've got appointments after appointments after appointments where you're checking and nothing happens. So why not take the braces off, give the kid a little freedom, make him a retainer, and then wait to finish your comprehensive treatment when all the teeth have erupted. Yeah. So it's a way to kind of hybridize the phase 1 and phase 2 approach, but when they're too late for phase 1, and how do you just not have it take 30 appointments in 3 years to do it?
I think Derek Bach, called the braces vacation. He kind of popularized that, at least in my opinion. But I know it's a solid strategy. So bracket placement. I know we do this a little bit differently. Also, what we do in our office is the assistant puts the brackets on the teeth. I do upper 6-to-6, then lower 6-to-6, and then I do the 7s. So they place the brackets, and I position them. With this strategy, you can have sometimes 4 or 5 bondings going on at the same time, and I kind of compare it to like airplanes. Get in line and take it off, and while you're at one chair, they can be putting the upper arch wire in, or talking about rubber bands, things like that, before I move on to the next chair.
Well, but again, back to the point, it's two sides of the efficiency coin, right? because you're doing it efficiently by breaking it down into segments, where in my practice, the assistants will prepare 7 to 7 upper and lower, and the doctor will come over and put the brackets on themselves in about an average of 6 minutes. So when you divide up the 3 minutes and 3 minutes, it's 6 minutes in separate parts. And for me, so again, like this is the whole fun of efficiency, is you could do similar things completely differently and still view it as efficient in your practice. But for us, yeah, I mean, we bond 7 to 7. It's about a 6-minute process. And for me, the experience has been that when brackets are on the teeth before they're properly placed, you run the risk of that ambient light starting to cure them. And I think it can increase the number of bond failures.
So we have 3 minutes.
Oh, wow.
So we're going to talk about some efficiency in an efficient amount of time.
Oh, we're good at that. You didn't use your bra. Okay, 3 minutes. Okay, go.
Let's go lightning round.
Lightning round.
Come on.
All right, I'm up next. 3-wire sequence for 80% of your cases.
Oh, yeah.
All right? And use continuous arch mechanics. We're not going to talk about it here. Come to one of the courses. See one of the amazing people speak about it. Go.
Yeah, for me, it's 016, 2020. Then your finishing wires definitely can shave some visits off of there. D-bonds. A lot of us talk about same-day starts. How about same-day D-bonds? These can be huge. If they're in the chair and their teeth are where they need to be, and we try to have them in steels or finishing wires for a few months.
That should be our mic drop right there. I mean, honestly, that same-day D-bonds, why schedule an hour appointment a month out when you're already a half an hour appointment in the office?
They're ready. Let's get them on. And it'll make their day. They will be pumped.
By the way, check with a parent before you ask them to get them off. Otherwise, you have a very upset patient. Yeah. Assistant briefings. How about this? Why have the doctor come over and spend minutes reading the chart to learn what's going on? The assistant's been there. Give the doctor the lowdown on what's going on with a patient stat.
Yes, indeed. Retainer checks. We do this a little bit differently. I do one retainer check. I don't think more is necessary for most cases. I like to do one because of closure. I like a little closure and get some good pictures when their gums are nice and healed up. But
one retainer check, zero retainer check.
We're down to 0, yeah.
Wow, nice. Good for you.
Patient motivation. This is one of the things like, you coined free efficiency at its finest. And Cole and others talked about patient motivation day, like Cole during his cooking segment, which was amazing, by the way.
No, thank you.
That food was legit.
It was really good.
Yeah.
But Cole talked about actually engaging with the patient and telling them what's in it for them. So here's the interesting thing, like motivation is one of the biggest problems in orthodontic. We call it compliance, but in the profession, we changed it to motivation. If you can get patients to engage in what they're doing, that is free efficiency.
Absolutely.
Or Feldman's free efficiency, because you're doing no extra work after coaching and mentoring them to get them to do what you, the orthodontist, we need them to do to finish their treatment. So motivate your patients.
Yeah.
Feldman, what's up next?
I think we're going to talk about admin days, and this is something you kind of shine the light on for me. When you get more efficient and you work less clinical days, you have more administrative days. Your team appreciates that.
And then everyone goes,
more.
so do you pay them those days you're not there?
Absolutely.
We're like, heck yeah. They do everything in the office.
You are not
deliveries, marketing, painting, trim, cleaning, whatever.
Yep.
And you know what? Sometimes just having a cup of coffee and being a good team member.
Yeah. Working on the practice, not in the practice.
Mental health break. And that's, on my admin days, that's where all the retainers are made. So
was that all the
You told us 3 minutes,
you told us,
man.
All right, man.
Well, you could.
That's
Was there no more?
Bomb.
No, there's no more.
Oh,
I mean, we
really
can talk about this for a while if you
No,
really
I know
want
we
to add some
can.
segments.
That was good. No, I thought there were more. Oh, you're telling me. Okay, sorry. I'll wrap up. Let's wrap up with this. Maybe 2 or 3 things, because I like to, we've listened to all these. There's great ideas. There's a couple of these that I need to work on. What are maybe the 2 or 3 most important things that you see commonly in practices that, hey, fix this and you'll become more efficient? Maybe that's a tough question. Maybe I shouldn't ask that.
I would say, we've talked about it today, appropriate delegation.
Okay.
Like teaching your team what you do, how you do it, why you do it, when you do it, and then teaching them how to do it effectively. We had a conversation the other day with Shane, right? And I've never put a fixed lingual retainer in. You do them all yourself, and Shane delegates them, but Shane etches and primes his own bondings, and we delegate that. Like, how do you, where's your comfort level with delegation? And, we have amazing teams, so how do we coach and encourage them to do things on our behalf in the vision that we would do? That would probably be the thing for me.
Mine's just, honestly, understand the concept of what we're talking about and why it's so important. You have to monitor this. Yeah. Most orthodontists that I've talked to, and I was like this a few years ago, you ask them how many appointments it takes them to finish a case. and they have zero clue.
And
that's
actually,
a problem.
that's a great
you know,
point,
like
because
I feel bad for them almost, like, you know, we all have the most amazing job ever, but like, you really don't know what you're missing out on until you understand like how much better it could be. And I know, you know, I'm not an expert in this. I'm a student of the game for life, but like, I'm still learning. I'm just scratching the surface, and I know that the gains I've made, like, there's still more to come, you know. So I don't think I'm there.
You say you're still learning, but
close.
you're in the master class because you're down at 14 visits, and that really is the key. Is that people don't know, so they don't like. If you're not tracking it in your practice, you don't know how inefficient you are, and your inefficiency, like you said, if you judge your busyness by coming in 4 days a week and how many patients you see a day, well, let's turn it around and say, what if you could do orthodontics in one visit? How many days a week would you be in the office, and how many patients would you see a day? Like, if you could just mint out orthodontic results in one visit some magical way, it would be a totally different orthodontic practice than it is now. And so awareness is the first step to realizing that you have a problem. And what I'll say about Chris is amazing is he was the guy that said, we're great in our practice. And he called me and he said, we're not. But he said, but I am going to be, and guess what? A few years later, he is. He's one of the masters in the profession at it.
No finish lines.
So we have the case study right here. So hopefully it inspires you. You guys were awesome. My mind has been blown. The efficiency bombs are scattered. You know, the shrapnel from these efficiency bombs is everywhere. So great job, guys. Excellent stuff. Speaking of delegation, wouldn't you know, our next segment is on just that. So Shane and Brian and I are going to talk about a doctor that likes to delegate a lot and a doctor that doesn't delegate very much at all. And maybe if you're an assistant, kind of what that's going to be like. But first, we have a short commercial break.
Neon Canvas has helped over 100 orthodontists in 40 states and Canada grow their practice by generating quality leads online. We start by helping orthodontists tell their story in a compelling way through a custom-designed website that is optimized to produce great results. Our fully loaded team of designers, programmers, SEO experts, videographers, and copywriters will make sure you have an eye-catching presence online, and we even help you establish an engaging presence on social media. We also have a proven track record of successfully capturing online shoppers through targeted Google ads. Our custom dashboard always lets our clients know where their leads are coming from and what their return on investment is. Are you curious how your current website stacks up against the competition? Visit our website to get your free digital marketing audit. We will examine your site's architecture and design to find the issues limiting your potential to set appointments with new patients. This valuable audit is free, whether you end up choosing Neon Canvas or not, so visit our website today. For new practices just starting out, we offer a product called Neon Now. You get an agency-level website without the agency price tag fast. If you need to get going quickly and start generating leads, check out Neon Now.
Hi, I'm Dr. Sam Burrow, Welchel Culp Orthodontics down here in Charlotte, North Carolina, and just want to take a minute to talk to you about the 3M products that we're using and loving. The first two that we really have to talk about, we use a number of them, including the brackets, the forces, the aligners, and all that. But what's really made a difference in our practice is the Clarity brackets as well as the Clarity aligners. With the aligners, it was a big change, and I can attest to this. I know that we used Invisalign. We're a really big practice, so we had a lot of cases going on, so it's not a small feat to go ahead and try a different aligner system just because of the stickiness of the one that you were with prior. I will say that it's been the best change that we have made. We went all in, so we weren't just doing a few cases here, a few cases there, and I highly recommend that because the support 3M has given us has been outstanding. Anything that we need, dependability, accountability on their end, just able to get these cases done and done very well. Our results are now coming through. We've been doing it for over 2 years now, so we're seeing a bunch of finished cases come through, and the results are fantastic. We couldn't be happier with the way they fit, the comfort for the patient, the ease of getting the ClinChecks in, out, and trays in the patient's mouth. So we commend them greatly on that. With the Clarity brackets, we've also made a good campaign, and that's helped us grow our business a lot in certain areas and certain locations. We've done campaigns where we're getting a lot of the clear brackets on some of even the teenagers. They get to put colors on them, and really think that's pretty cool. So we get a couple of the kids doing that, and they tend to tell their friends about it. So it's really been a nice upsell for us, and has really helped us grow our practice. In terms of what we like working about with 3 a.m., some of the things that I mentioned before, their dependability and coming through. We can always get the products when we need them. Quality is super high. It's always very nice to tell the patient that we're working with such a nice, dependable company. They always trust the company, which helps them trust us to do their treatment well.
Hello and welcome back. The award for the longest interview title of the meeting goes to this one, and it is officially called the Clinical Delegation Continuum, Assisting Orthodontists Who Delegate and Orthodontists Who Don't. I think I said the same thing last night, but who wrote this crap? Oh wait, I did. I like it though. You can use that. Y'all go on the road and lecture together.
There we go.
The very important topic here, which it's great because in the efficiency lecture, if you heard this, Koz brought this up, is that delegation is a big part of clinical efficiency and even admin efficiency. But we got to talk about this because some doctors love to delegate, some doctors don't, okay? And so there's assistants out there who are working with different types of doctors, some who delegate, some who don't, and I want you to learn about the values and maybe some of the negatives about both of these things. So Shane, I want to start with you. Do you like to delegate clinically a lot? Why or why not?
Yeah, so no, I really don't delegate clinically very much at all. And I think there's the positives behind it from my perspective really are mostly consistency based, because you're only as good as your weakest link. And if you have 3 great assistants and 2 not so great assistants, then you're going to have, 2/5 of it's going to be offset not so great. So I wanted to have a manhandle, or a handle, not a manhandle.
Shane, what are you doing out here?
Manhandles over here.
It's all about how much they can bench, you know?
Those are love handles.
How much can you curl?
I want to have a handle on the efficiency from a clinical perspective, and I tend to be a control freak. So watching bond failures and things like that are kind of important to me. But I do recognize the need for balance, and I think I tend to be on the side of it that doesn't delegate clinically at all. I prime, I etch and I prime, and I place the brackets myself. I don't allow that to be delegated. I don't delegate bonded retainers. I do those from start to finish. My staff will have everything prepared for me, but I go etch, prime, and bond. And all that's done by the doctor. So the benefits to that too, from a perception perspective, is one that if you've ever had an experience in another orthodontist office that the doctor didn't place the brackets, then the parents are like, "Oh, you're putting the kids' braces on?" I'm like, "Yes, ma'am. That's how we do it. You're paying me the money." So there's that perspective too. But I'm interested to hear from your side how I can change, because I need to change a little bit. So.
I'm guessing that you must be the opposite.
Yes.
Okay.
I am.
Even though we're color coordinated.
So first
today.
of all, I mean, we've been on every panel
I know.
meeting, and then today we show up and it's like, this is too close. I think he had a camera in my room. I'm trying to Boyer Shane over here.
I'm not creepy now. I'm not creepy.
But yeah, so for me, I mean, I think Shane bring up some good points. And like every time I talk about anything, I always say, listen, there's no right or wrong way. I'm not saying my way is the right way. It's all about preference. And for me, what I fixate on are some of the things that kind of get my gears turning is the fact that I hate having a clinic that is backed up. And so for me, the more I can delegate frees me up to do other things in the clinic to make sure everything runs efficiently and as smooth as possible. And so one of the things that he hit on is the fact that you're only as good as your worst team member. And that is absolutely true. And so one of the things that we try to do in terms of having to standardize all the protocols is, one, we have calibration days where we get everyone, after we've kind of been in it, no matter if you've been there forever, just starting, doesn't matter. We kind of have a day with no patients so that we can just get everybody back calibrated on kind of what we want, how we want to do things. And then the other things, and not to sound like a repetitive person, is the technology that we invest in allows us to take away that independent way of doing it. So in other words, if I'm using Light Force, for instance, and I have the indirect bonding trays, I've already done all the work myself. So it doesn't matter which assistant puts the brackets on, it's going to go exactly where I want it to be. And so I think doing things like that, which takes out the the interpersonal preferences or way of doing things kind of really gives you that consistency so that you can feel comfortable delegating, because it is tough. You know, you want things to be right, and you're trusting your team members that they're going to carry it out and do it how you want. And so it's hard to do, but I think some of the newer technology kind of allows for that standardization across the board to help out with it.
Yeah, what I hear you say basically is training and trust are the two keys to that. Yeah. And I'm a control freak and have trust issues apparently. No, I'm kidding. But
I was actually about to say those exact things. You read my mind.
So I don't even delegate like attachment placement on liners, and that's something we set that up. We've had the attachments where we want them. There's a template for it to go. It could easily be delegated, but I've noticed a difference when staff members do it. We put a little bit of active pressure while my staff member attacks each attachment, and there's less flash. So we've seen things in scans, and I'm like, man, I just feel like I need to hold on to that, but
so
I don't
let me push
let go.
back.
Yeah, please.
The first time you placed an attachment template, how did it go?
Not so great. Yeah.
The first time you placed brackets, how did it go? What about a fixed retainer? You know, so I guess, and I don't want to bring my thoughts into this because you're going to feel ganged up on. Because
not at all. I will not feel
I
ganged up
delegate
on.
everything. You could handle the two of us. That would be a good wrestling match.
That
actually,
would be.
You know?
Listen, somebody
like we're on
goes
this
high,
side.
somebody goes low, and listen, we can get it.
But no, I do think the beauty of delegation in general, and it applies to like literally anything that happens in an organization, is not just that you're able to put things off on other people so that you can do other things. It's actually, believe it or not, that you'll find that people are oftentimes better than you are at doing it. So that does require trust, and it does require leadership and training and all that kind of stuff. Not everybody. I think I'm really good at placing brackets, but I've got some team members that are also really good at it. And I still come up and I check. And we standardize via the way of, like, we use APC brackets. Now they're flash free, so it doesn't take that long. They put them on there. We use a height gauge so that it standardizes it more so. They know my preferences. After 4 or 5 years of placing brackets and me coming up and checking them and them watching me, they get pretty dang good at it, you know? And then we have our standardization times. What did you call it?
Calibration.
Calibration. Yeah, we do that kind of stuff. 3M rep comes in, Chris comes in, he goes over how to do the bonding, all that kind of stuff. And honestly, I mean, you'd have to see it kind of in motion, and you may be like, this is terrible, I don't know. But I think you'd say like, oh, that's pretty cool. And it does free me up to do important things like get on Facebook, you know? And I need to do that through my day.
Well, we can only be in one place at a time, so if you're supposed to be in 5 different places at the same time, that will drag you down. And we have this little light that'll flash, like when you have waiting patients over a certain number, and when I see that blue light flashing, I'm like,
okay,
oh boy.
I need to...
I start sweating a little bit. Yeah.
So Shane, though, obviously there are positives of delegating less, and that's the point. It's not to beat up on one way or the other, and you can make arguments either way. And these really aren't even arguments. We talked about this. It's not like we're arguing with each other. It's just we're kind of discussing it because I do think it is a very central conversation that I don't hear discussed a lot. But what are some positives of delegating less?
Delegating less, like I said, but the biggest positive for me is just the consistency between I'm the same person doing it on everybody. It's done the exact same way. And I think that's a fairly strong positive, but if I can get past that with the training aspect, I think that would be helpful. I have 17 clinical assistants in 3 offices that we're trying to, so it's hard to train everybody to that same standard, and the more you have, the more chances there's going to be something not done the way I want. But the more we grow, the more need there is to learn to delegate. So we do calibration days on things that I do delegate, such as tie-ups and certain things that we do. We want them to do it the same way. If somebody's making a half bracket active open coil spring, I want it to be the same with each staff member.
Sure.
I've just not come to that place where I know where I want to draw the line on where I want to delegate and where I don't. And
well, where is that line? That really is like the big question, because certainly, I need to delegate fewer things than I probably do. I probably am guilty of, like, especially when we're really busy, like, oh, just tie it in, you know, or just go ahead and cure that bracket, or whatever it is. And so I probably need to come closer to you, and maybe you need to come closer to me, and then Brian's in the middle, you know?
Yeah.
I'm just playing.
If we get
little Brian sandwich, little Lockhart sandwich, little Cass sandwich. I don't know.
You got it right.
I got it right. Huh? Yeah, finally. So Brian, maybe give me some positives of delegating more. What are those?
Yeah. So the other thing that I think kind of gets overshadowed a lot is we look at the results that we have from delegating and not delegating, but I look at it as empowering the team. And I think a lot of them enjoy that. Like, if you think about some of the assistants that are, general dentistry, where they kind of just hand things over and just kind of do things. I tell people at the beginning, like, you're going to do a lot more than what you're probably used to. And I think they like having that responsibility of feeling like they are a big part of the team because they have a big responsibility to do it. So I think that empowers the team to really, step up to the plate and do more. The downside of it is the opposite of what Shane said. I mean, sometimes, that wire walked out with, too long in the back. Or maybe they were etching and the patient closed down and it got wet and they just said, it'll be all right, and moved on. And so the bond, so you have that there, but the more you kind of harp on it and kind of go over things over and over again, they understand the importance of every single step. Then you finally get the ones that say, I walk over, like, what's taking so long? Well, they moved and it got wet, so I had to dry it off and start all over. And it's like, you don't get mad at that person. You kind of congratulate them because they understand the importance of it. But even still, you lose some control over some of the aspects. But the way I look at it is, we're not seeing people one time. We're going to see them over a length of time. So if anything gets out of whack or whatever, it can be reeled back in, and everything will kind of turn out like it needs to be.
I agree. I think the empowerment part's critical. One of the things our staff in general love about their job is the autonomy they have, the ability to kind of do a lot. And for me, taking that next level with you wouldn't be that far of a step to go from what they do currently do. It just requires me to be ready to train and trust.
Yeah, for sure. All right, so we're going to keep going through this, kind of looking at positives, negatives. Shane, what are some negatives of delegating less? And you've kind of gotten at some of this, but
yeah, like I'm not in one. I can only be in one place at a time. So you get to this burnout stage where you feel like, oh my gosh, I'm doing so much, and we'll see 90 to 100 patients a day out of a 5-chair office, and just with one doc. And if you're not delegating, that becomes hard. So you just get to the point where you're just tired, physically tired. It's a lot of work.
I feel like I delegate as much as I can, and I'm tired. So I can't imagine how tired I am. And then you go home and you got 6 kids and like 17 animals.
So looking at things from that perspective, I'm like, man, I could free my life up a little bit to go home with a little more energy, and that's important. This is a longevity thing. This game is the long run, and I'm only been in it for 12 years, which seems like a long time to
Has
some.
This started to feel like an intervention for Shane?
I do. It's like it's therapy. It's like I've realized that my life is
Come on, everybody, come on out.
Well, I'm sure I'm not the only person that's watching this that has
Absolutely
control
not.
issues too. So it's probably good for them to see I'm not the only one who doesn't delegate. Maybe this is how I can work through that.
There was another officer. Not sorry to cut you off too. I forget who it was. But he literally did everything, even the adjustments and the tie-ins. And so,
some states make you do that.
Yeah, so I mean, it's no right or wrong way. If it works for you, that's all that matters.
Yeah.
Yeah, I think that's right. So negatives of delegating more, and I think some of these are self-evident, but just to say them.
Yeah, it's the biggest thing, the lack of control. I mean, you put systems in place and you try to hold your team members accountable for it, but at the end of the day, you're still having someone else be the last set of eyes on something that's not you, and you can have some of those quality issues in terms of bracket failures, wires poking, whatever it is that can be associated with orthodontics. So that lack of control is one of the downsides. And so you just harp on that and try to minimize that as much as possible. You'll never get rid of it totally, but you just try to keep working on it. But that will be the biggest downside, is that because you're not looking at everything and kind of having your hand in every single step, it's kind of hard to really be in the moment.
Yeah.
To address that a little bit with how we do things, I do delegate certain things, and we have a clinical coordinator in each office. Yeah. And that clinical coordinator's job, especially with a fairly newly trained assistant, is to check everything before the patient walks out the door. Yeah. And she'll check, and if they have it right a certain number of times and she starts to feel comfortable, she'll come back and talk to me and say, okay, I think they've got it together now, they can self-police. Yeah. But instead of my eyes being on it all the time, I do have someone I delegate that check that I trust. Yeah. And that way it's not 7 different people doing things 7 different ways. It's my one person who I know I trust can go behind me and make sure that they're leading.
Like a mini you.
A mini me, like a mini me. A mini me.
Now I'm thinking of mini me now, and the mini Dr. Evil, and I don't know. So now I've lost completely my train of thought.
It's hard to put a big beard on a female, but
Here's the reality. Like, for those that delegate, I delegate everything that I possibly can. I mean, really, and I know there's people that delegate even more. This is why it's called the clinical delegation continuum, though, because there are some people, I've known doctors that like literally do everything, untie, change wires, tie, check them out, all this kind of stuff, but it all takes time, and some of those steps are really just not essential to the quality. You may create in your mind that they are, and actually I would even go as far as to say is that some of those things can be done better if you've delegated some of those things, because you're having to rush through this one process to be able to get to this other process, and now you've actually lowered the quality by enforcing your place in that. And I know doctors that they don't have a TC because they're the TC themselves because they don't trust anyone to go over the finances. It's like, it's kind of craziness at a point.
Right.
And so it is a continuum, and there is a place on there that is most appropriate. And the negative of delegating too much is that no doubt the quality does start to slip in some ways, and yet corrects in others, and there's ways to, like you say, adjust for it. And it's not the end of the world. Thankfully, we're not doing brain surgery.
Right.
But it is important too. So here's the kind of the ending sort of sentiment that I think applies to both of you guys as guys that do a lot of digital and technology stuff. Does it seem that technology, perhaps, and the developing technologies are a way to bring these two competing philosophies closer together? Do you see that?
So,
I do, yeah.
Yeah, I would say, so the thing is, it can be yes and no. Because you can incorporate digital and still have trust issues, and you want to have your hands over everything.
Right.
So in other words, if you're doing whatever system, doesn't matter, Light Force, Embrace, anything, aligners, anything that comes in a quote unquote indirect setup way.
Yeah.
Like you can have Shane where he still feels like he needs to put the attachments on. So you can have this incorporated into it, but I think it's more of a personality trait and what you feel comfortable doing in your office. I do think the digital avenue will help lessen some of that, I need to be in on everything. But ultimately, if you just want to make sure everything is perfectly right how you want to do it, it's not just going to be a switch because you've done something digital that all of a sudden you're going to let it be a free reign in there. But I do think it'll merge things a little bit closer together, though.
Yeah. What about you?
I think the closer we get to taking away error and removing that, like you said, the closer I'll get to saying, okay, I can delegate that now. Yeah. As long as there's a lot of potential for error, I tend to shy away. But I think technology is bringing us to that place, especially with indirect bond setups and aligners and things of that nature, that we've done all the setup side of it. We've done all the parts that we can control, and then it becomes an issue of just a training on a simple, hey, this is how you do an attachment template setup, and this is how you bond it. Go do it. So the closer I get feeling less error, the more inclined I would be to delegate.
Yeah.
Right on.
I would agree with that.
My trust issues would be less at that point. Exactly. Still may have some, but you got to let go at some point.
He's still gonna be manhandling people, but it's just gonna be a little less.
If you mess up an attachment placement, you got to go do 20 kettlebells.
Choked out in the break room.
Yeah, exactly. So another exceptional. Y'all are together on every single.
Yeah, we are. Yeah.
Who made that agenda? I guess that was me.
I've enjoyed it. Enjoyed it.
No, but y'all were great together. I want to see you go out on the road. So, if you're an assistant who works with a doctor who delegates everything, or one who doesn't delegate a single thing, or if I messed that up, I don't know. But hopefully you've learned some things from this conversation. If you're a doctor that feels like, oh, maybe I don't delegate enough, or maybe I delegate too much, hopefully this has been helpful for you as well. And I think the point is it's not necessarily a bad thing. There's pros and cons to both. And so we're about to have some Memphis barbecue.
Let's do this.
I think I smell it coming in. It smells very good. It's going to be a very fun segment that Alex is going to host here. But first we have some pro tips from Scott Hansen and Tracy Martin. Enjoy.
Hello everyone, I'm Scott Hansen, practice growth consultant and CEO of Lead Sigma. My pro tip is for growth-minded practice owners. Today, customers are less patient and more distracted than ever. They've been conditioned by businesses like DoorDash and Uber Eats that when they want something, they should get it right now. What does this mean for your orthodontic practice? When a patient fills out an online appointment request on your website, they want to be taken care of right now. A Harvard Business Review study showed that if you call an interested new patient back within 5 minutes, as opposed to an hour later, you're literally 10 times more likely to connect with them on the phone. In addition, if we open up lines of communication with our new patients by way of text and email, we're even more likely to connect and schedule exams. More successful connections equals more production. So it begs the question, does your practice follow this 5-minute rule? To answer that question, our team conducted the most comprehensive study of new patient lead responsiveness ever completed. After collecting the data on more than 4,000 practices across the US, here are the results, and they might alarm you. Only 88% of practices call their new patient leads at all. And for those that did call, it took nearly 6 hours to make an initial phone call, and only 25% of practices bothered to call a second time. Only 48% of practices email their new patient leads, and only 26% of practices text their new patient leads. On a totally separate note, 5% of the forms on orthodontic websites don't even work, and those guys need an immediate consult with Neon Canvas. We received absolutely zero responses from 12% of the practices that we studied, which is just wild. The pro tip is this. If you value practice growth and want to schedule more exams, you should be calling, texting, and emailing your new patients within 5 minutes of their inquiry.
Hey TDO Live, Tracy Martin here with Straight Consulting with another pro tip for you. The theme of this weekend is how to be the best orthodontic practice. And I think if you want a real shot at that title for 2021 and beyond, then I truly believe that you have to nail virtual appointments. Now, forget the platform and the software. I'm just talking about the mindset. It's all about meeting patients where they are at. And as a millennial mom, it's all about making a game time decision. My day can go sideways real fast. While I had every intention of coming to that 4 o'clock appointment for my adjustment, I would love to, but I can't. So can I call you and make it a virtual appointment? When it comes to switching from in-person to virtual appointments, it's all about lining up the doctor time in your templates. So question for you, are your scheduling templates set up to let the millennial mom have an audible to decide at the last minute if she wants to bring her kid in person or just throw them on a virtual real quick? Just make sure that you've got those set up right and you should be good to go. Good luck, may the force be with you, and I can't wait to see you guys in person.
Welcome back. It's barbecue tasting time, and look who it is. Grizz has got us some barbecue. Memphis barbecue for the win, baby. Thanks, Grizz.
Thank you.
Go Grizzlies. Thanks, Grizz. All right, so as you guys know, Memphis is known for its barbecue. The Memphis in May World Championship Barbecue Fest is the biggest barbecue cooking championship in the entire world. So what would a meeting in Memphis be without a little barbecue contest here of our own? So thanks to Grizz for bringing us some barbecue. We've got an assortment of barbecue here. Since pulled pork sandwiches are the main attraction in Memphis, we've got sandwiches from 3 local spots: the Germantown Commissary, Central Barbecue, and One and Only Barbecue. We've randomly numbered them here on these plates, so everyone is going to try a sandwich, and we're going to vote for the best one. Here we go. So while we eat, I want to ask you guys a few questions. Go ahead, dive in, everybody. Let's eat number 1 first. Tell me what you think. And then Cole has actually baked some bread earlier during his cooking segment.
I wouldn't
Cole,
let anyone touch it till it's
Is it ready? Is the bread ready? So
we'll see.
Cole's gonna cut it to. Yeah, you guys. While Cole's eating that, let's dive in here a little bit.
A little rosemary.
I'm gonna try number 1 too.
Okay, that was good.
Is it good?
That's great.
Super good.
Courtney, what food is your city known for?
I would say New York City pizza. You know, there's like a pizza rat. There's a rat in the subway who drags pizza that he finds in the subway. It's very famous at this point, if you guys don't know what that is.
Oh, really?
But I'd say pizza. Pizza, hot dogs.
Rats and pizza and hot dogs. Nice. All the healthy things. Yeah. Chris, what about you? What are you guys known for down there? And
I mean, we got gumbo. That's probably our piece de resistance.
Yeah.
As you will. If
Yeah.
you will. Yeah.
Creole fare down there.
Cajun, more Cajun in my area, more Creole in New Orleans.
Yeah. Cole, you're out on the West Coast. What do you guys eat out there?
We're definitely Portland areas. It's food city, so
Is it?
pretty eclectic. So we get a lot from everywhere, but there's just a lot of hole in the wall, fancy little French cuisine and fancy
wow.
like small plate stuff. So
Yeah.
I mean, people aren't going out to eat to get full there. They're going out to eat to get this micro cilantro with some weird type of camembert.
Well, if you
cheese.
guys go out to eat, you have to book out the entire restaurant to fit your family in.
Oh yeah, we're going through the Wendy's drive-through, bro.
Yeah.
We're not-
Yeah.
And the food's probably not as good either.
Chicken nuggets for everybody. Nicole, what about you? What's your favorite food?
I think in Michigan, it's not my favorite food, but I think in Michigan we got a lot of Coney Islands. So, you know,
Okay.
it's kind of like diner. We're known
okay.
for Coney Islands, yeah. Coney's. Yeah.
What food do you guys miss the most? Kind of since COVID, is there a restaurant or something that you guys hadn't gotten to enjoy that you miss?
Dude, just sitting down and let someone else cook and do the dishes. That's
Yeah.
all. I mean,
Yeah.
you could feed me anything, dude.
How's it going? You
Are
guys
we supposed to
tasting?
work our way through?
Go to number two.
I made my decision.
Go to number 2.
And then I'm still on 2.
These really do have different flavors. I really thought you guys caught up the same one.
They're completely different.
I got my order.
I got my order.
You got your order?
Mm-hmm.
What snack is your guilty pleasure, Nicole?
Oh. Well, it's not my guilty pleasure, I don't think. I don't feel guilty, but the first thing that came to my mind was sushi.
Oh, I love
First
sushi.
thing that came to my mind.
I love sushi. Do you get good sushi in Michigan?
It's
You know.
Yeah.
decent.
You know. Some of that farm raised stuff.
Yeah. We gotta travel a little bit to go get good sushi.
I love it. Do you have a guilty pleasure, Cole?
Yes.
We're talking about food.
Sometimes I'll be cooking like, thank you. But my guilty pleasure is like eating like the crappy little chicken nuggets and cheese sticks and like, like the goldfish crackers that like, my toddlers leave out. Like to me, like I can cook something super fancy, but at the end of the day, dude, give me like a lukewarm chicken nugget. I freaking love it, dude.
What about you, Chris? You have a guilty pleasure?
It's crawfish season right now, so boiled crawfish.
Okay.
You can become a complete glutton and
Yeah.
eat pounds and pounds of boiled crawfish, and the more you eat, the worse you're going to feel the next day.
Yeah.
But you just eat until you cannot eat anymore.
Well, 2 questions follow up there. One, how many either pounds or actual crawfish have you eaten in one sitting? And 2, what is the proper way to eat a crawfish?
So the most I can remember is about probably 10 pounds, and that's 10 pounds of crawfish before you peel them. So it's not 10 pounds of meat. It probably translates to maybe 3-4 pounds of meat, but it takes time to peel them. So you're having a good time, drinking some beers, while you're eating. So it takes a while.
Slows you down on
So the proper way
10
is,
pounds.
we could have brought some crawfish. I should have done that, but you pop the tail off. You can peel. There's different techniques to do it, but you peel off the outer shell, and plenty of different types of sauces you can make. Usually it's a mixture of ketchup and mayo with a little bit of spices in there, and dip it in, and it's delicious.
Well, I know some people insist on sucking the guts out, right? I mean,
Some people do that. I'm not into
so
that.
that's
but,
not the proper way to eat a crawfish.
Well, there's no wrong way.
No wrong way.
There's no wrong way. We don't judge.
I love it.
Crawfish and Oreos.
All right, guys, we got to do some voting here, right? We could do this all day. We could sit here and eat, but I think
I
everybody
feel very
else will
strongly
say-
about my order. I feel
All
strongly
right,
about
all
it.
right. Well,
I feel pretty strong.
Cole, why don't you give me your number one?
I got 2.
You got 2 number ones.
No, I got my
Number 2.
my number 1.
Oh, your number one is number 2.
You want? Let's call it first place, second place, third place. Not so I don't get confused, so you don't get confused.
Wait, who's
I
on
know what I'm
first?
talking about, Alex. So what's my number 1?
Yeah,
my first
I
place.
just want your top pick.
2.
Number 2. All right.
What was that?
Oh, okay.
Well, you know.
Nicole, you have a little feedback there. What about yours?
2 was my last choice. My
What?
first choice
Oh,
was number 1.
Oh,
wow.
Okay. All right. Chris, what about you? What was
2, 1, 2, 1, 3.
So number 2 was your favorite.
Make it simple. 2, 1, 3. Yep.
Okay. All right.
yes.
Dr. Courtney?
I'll give you more numbers. to make it
213.
simple.
By the way, Dr. Courtney gets the Happy Plate Award.
I'm
The
from
hab-
the Clean Plate Club always.
The Happy Plate
Leave it
Award
to
goes
the
to Dr.
Wait, and I
Courtney.
gotta tell you my guilty pleasure because it's been staring at me from the moment I walked into this
Oh, I didn't
house.
get to ask you your guilty pleasure.
It's those Sour Patch Kids over there. Okay, they will
Sour
be
Patch
missing
Kids.
when I leave the house.
I love Sour Patch Kids.
But
I love it.
I'm gonna go against the grain, but not purposely. I like number 3.
Oh, you know what?
No,
I
3
like-
was my second choice.
I like number 3 also. It was also my favorite. I didn't do that just to piss up the Courtney either. So we have a tie. We've got a tie between 2 and 1. I think the only way to break that tiebreaker
We're
would be
between 3 and
2 and 3.
Nope. Oh.
2 and 3 for
2 and
first
3.
place.
2 and 3 for 1 and 2.
We
The
didn't
only
plan the
way to
Abbott and
break
Costello
that
thing, guys. We
is
did not
for-
plan this
Yeah.
Abbott and Costello bit.
We did.
Like 2 and 3 are tied for 1.
That's right. 2 and 3 are tied for 1.
Okay.
But who's on first?
So, how's that work?
Well, I think we're going to put
I'm gonna
Nicole
make
on
it
first.
simple and give you 5 numbers.
Yeah. So Nicole, you break the tie. Since you didn't vote for either one of these, you be the tiebreaker. Why don't you give me between number 2 and 3 which one you would choose?
Hands down 3.
Right.
Number 3 is the winner. Let's
true.
find
That's
out what the best Memphis barbecue is. The Germantown Commissary, which makes sense because we're right here in Germantown, Tennessee. Dr. Cobb's
Okay.
house. So hey,
I'm not mad at
there
that.
it is. Yeah, it wins.
I'm not mad
So
at
there you have it. The best barbecue in Memphis is the Germantown Commissary, according to our expert panel of foodies here. How's that bread down there, Cole? Pretty good?
Yeah, we'd love a piece
I like
of
it.
that.
A little rosemary garlic action. Yeah.
I love it. I love it. Well, hey, the next up, Dr. Cole's going to be discussing treatment coordinator tips with Dr. Courtney, Dr. Cole, and his wife Anna. I don't know how you guys are going to get from here to there, but you better go.
All right.
So there you go.